Good morning. I'd like to welcome everyone to our monthly webinar, Youth E-Cigarette Prevention and the Catch My Breath Program, Policy Prevention and Implementation. My name is Peter Cribb and I'm the National Program Director at the Catch Global Foundation. Before we get started, I'd like to take care of a little housekeeping. First of all, our webinar today is being recorded and an archive will be made available on the catchinfo.org website, along with a PDF of the presentation slides. During today's webinar, we encourage you to ask questions via the control panel on the side of your screen. You can type in your questions at any time, but to keep us on schedule, we will try and hold off on answering them until the Q&A portion at the end of the presentation. When typing your answers into the chat box, be sure to select the option to send your message to all attendees. Next, I'd like to let you know a little bit about the Michael and Susan Dell Center for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families and communities. Our work fosters health behaviours among youth, influences policy and environmental change to support healthy living and advances professional education and community service. I'd also like to share a little bit about the Catch Global Foundation. The Foundation's mission is to improve children's health worldwide by developing, disseminating and sustaining the Catch platform. We link underserved schools and communities to the resources necessary to create and sustain healthy change for future generations. You can learn more about the Catch Global Foundation at www.catchinfo.org. It is now my pleasure to introduce our special guests for today, Barry Sharp, Dr. Steve Kelder, and Lisa Cummings. Barry Sharp has served as a health educator in the Texas Department of Health Services since 1993 and currently is the manager of the Tobacco Prevention and Control Branch in the Health Promotion and Chronic Disease Prevention section. Now in his 17th year in tobacco, he has served as a Tobacco Prevention and Control Program Coordinator and was the initial coordinator of the Texas Youth Tobacco Awareness Program. His other public health experience includes health promotion, clinical prevention services, community and worksite wellness, and community preparedness. Dr. Steve Kelder is an original co-coordinator of Catch, Associate Regional Dean and Distinguished Professor of Epidemiology, Human Genetics, and Environmental Science at the University of Texas School of Public Health here in Austin at the regional campus, and is the co-coordinator of the Michael and Susan Dell Center for Healthy Living. He is a world-renowned child health expert with specialties in tobacco control, physical activity promotion, and nutrition education. Dr. Kelder is the author of the Catch My Breath program. Lisa Cummings has been in the healthcare field for over 21 years. Lisa has been part of the Kishwaukee Health System for over 9 years, working on the floor as a pediatric nurse and also as a community wellness educator. In 2010, Lisa was given the full-time role as the community health liaison for the Kishwaukee Hospital in DeKalb County. With childhood obesity as a focus for the health system, Lisa became a Catch trainer in 2011 for both Catch Kids Club and the school-based Catch for the county. Lisa coordinates the Catch program and works closely with Northern Illinois University students to bring Catch to the classrooms, after school programs and summer programs throughout the community. Welcome everyone. And Barry, I believe you're going to get us started this morning.
Good morning everyone. Appreciate the opportunity to be able to share a little bit about what we're doing in Texas with e-cigarettes and a little bit how what we're doing seems to be very similar to what's going on across the country. First, I really want to come out with just kind of what a straight definition is. And the term that we use here in Texas as part of our legislation and how we look at, define this product is the e-cigarette is the electronic cigarette or any other device that simulates smoking by using a mechanical heating element, a battery, a circuit, something to deliver nicotine or other substances to the individual who's inhaling from that. Does not include the prescription medical devices or anything else in that. Is strictly what we traditionally see as just the tube with the battery heats it, we inhale it on there. Next slide, please. What we're seeing as far as who's using it, and that's kind of what's been getting our attention quite a bit, and I think our numbers are very similar to the numbers that I've been seeing coming from CDC as far as on the national side of it. This is 2015 behavioral risk factor surveillance study data that literally just came out about a month or so ago. When we're looking at 18 to 19-year-olds, that's kind of a big population of using both traditional cigarettes and the electronics. And if you look at the top of the bar graph there, current cigarette use is running a little bit over kind of in the mid-low teens for us here, about 15%. But if you look at the electronics themselves, the 18, 19-year-olds are a little bit higher than that on cigarettes. Electronics, the numbers are actually lower, somewhere around 4 or 5% for all adults, but then you're looking at about around the 8% range there for who's using the E's. What's really amazed us on this is we look down at the bottom of the 3 blue bars, the dual use aspect of it. Our current end users who also report smoking cigarettes, of those end users, almost a little over half of them are also using cigarettes. Those who are former smokers who have been maybe using it to help them cut down or switch to a healthier aspect or device there, again, around 30% range. Those end users who've never smoked, of the adults, is a little bit over 10%. So it's kind of those folks who never used it, they're picking it up. There's a little bit of a concern, but that dual use aspect of it is a huge concern for us. Next slide. And when we get down to youth, this is past month use for grades 6 through 12. This is kind of those who are regularly using it versus the once, I've experimented with one time. And you can see on there from 2014 and 2016, the numbers have gone down for those who are using any tobacco, those who are using cigarettes. But the e-cigarettes in both 2014 and 2016 is much greater than that of those who are using cigarettes. And this is the same, very similar numbers of what we've seen from CDC with the National Youth Tobacco Surveys. So it is kind of a concern for us as a health department in that just the prevalence rates of that. The other thing that we found was interesting and a little bit disconcerting at the same time is when we started looking at and asking the kids, do you think these things are dangerous? And out of that, you can sort of see here we're comparing both 2014 and 2016 data, so you can see over time there, cigarettes, everyone has always thought they're very dangerous for the last several years. Those that think that the electronics, very dangerous, less than that of tobacco, or traditional cigarettes. Same thing with somewhat. But when you look at not very dangerous and not dangerous at all, those who think that cigarettes are not very dangerous think electronics really are not very dangerous or not very dangerous at all. So they're not getting the, the message in there that they're seeing is not necessarily that electronics are safer, but they're associating that with electronics being safe. Next slide, please. Something else we've been noticing and tracking for a number of years, our colleagues over at the Poison Control Networks, where the number of calls they've been getting from predominantly young children getting into the vials. You can see it's kind of really peaked up there from 2011 through 2013 and peaked out at 2014 with almost 400 calls. 2015 it dropped down to a little over 300. Just during the first 9 or 8 months of 2016, we're already well over 200, and if we keep that same rate up, we're probably going to end up close to the 300 range also. So is not just the tobacco folks that are worried about the electronics. It's, you know, from a poison control, from risk factors, environmental risks. It's quite a number of us that are looking at this. Let's go to the next slide, which kind of brings me to the big thing on this. When we look at what we do and look at how we address electronics, is very much like we address traditional tobacco. It's a real tapestry where everything is woven into each other. What we do on cessation impacts prevention. Prevention impacts cessation. Clean indoor air policies impact everybody, and impact both cessation and they impact prevention. So it's really kind of woven in there, and specifically some things that we're working on, focus on this prevention side of it. We have a Say What, which stands for Students and Youth Working Hard Against Tobacco. It's a statewide initiative really focusing on school groups or other community youth groups together to do peer education, to do outreach and advocacy within their school, within their community. We have well over 300 kids, or 300 groups rather, around the state, and they're reaching out in the neighborhood of 30, 40,000 kids of direct touch. Extended reach gets into the hundreds of thousands of kids. And so you have that wonderful aspect as they're getting this and they're educating, and as they're educating, they're not only just talking about traditional cigarettes, but they're talking about electronics. As we follow up on that, as young folks get a little bit older, we started a program a couple of years ago called Peers Against Tobacco, and it's really targeted toward colleges, both the 2-year schools, the 4-year schools, and our health science centers around the state. And again, it follows from that same model of peer education, of the youth being involved and educating, doing outreach to other youth. They're also doing part of that, they're doing analysis of retail environments around them and how easy is it to get electronic cigarettes. One of the things that in there is these student leaders will work with their administration to do changes on campus policies to where they'll go from maybe minimal of no smoking indoors to actually try to get to a tobacco and e-cigarette free campus on there. Most of our state's health science centers are already there. A lot of our 4-year schools are working on that. There's a large initiative going on with the UT system right now that's involving every one of their institutions to move them towards that. Right now we're working with about 20, 25 institutions around the state, and we're seeing a lot of movement going on as the policies change, as the change in the norms of the campus really go toward being a healthier lifestyle without tobacco. Something that we also do as part of our prevention aspect is we look at the enforcement of our state and federal laws dealing with youth access. As many of you are probably aware, the U.S. Food and Drug Administration came out with their deeming rules in 2016 that to include the electronic nicotine delivery systems, or ENDS, to include that in the federal rules for how they're going to enforce laws under as part of the FDA's enforcement activities. We're a state that has contracted to do these some 3,000 plus inspections off of that, and so we've incorporated that in our FDA efforts. But likewise, in Texas, our state laws were passed back in '97 initially to address sales to minors of tobacco products and minor possession, and those laws were updated in 2015 to include electronic devices. So we've really been trying to work with that and look at that to treat our electronic devices the same way as we treat our state. And one thing we found when we looked at our state, our violations rates on that this past year for us in Texas, it was about I want to say about 6%, 7% violation rate for traditional tobacco. Our electronics sales violations was actually about 5%, just a hair lower than what they were for the traditional tobacco side of it. And we were quite pleased to see that aspect of it, because we were as you can see and saw from the previous slides about the prevalence rates of youth, when we hear from the retailers that no one's actually, they don't want to sell to the minors, we kept wondering, well, how are they getting them? So obviously it's not all just through straight sales. But again, this really is kind of just a piece of the overall efforts in that you have to do everything on that. And what we're doing really fits in with what other state health departments are doing also. And so I see my time's up, so I'm going to turn it over to Steve and listen in.
Great, thank you, Barry. And remember, if you've got questions for Barry, type them into the control panel on your screen. It's now a privilege to introduce Dr. Kelder.
Thank you very much, and thanks, Barry. Thanks, Peter. And thanks, Brooks, for I watched him trying to deal with a technical problem. he got it done with a minute. Anyway, yeah, so I'm going to talk about Catch middle school program called Catch My Breath. And I'm also going to give you a little bit of background about tobacco and e-cigarettes. But the very first thing I want to say has to do with what's going on in America. Barry gave us the Texas scenario, and the rest of the country is not really all that different, I think. But clearly there's been a plateau in the reductions that we've seen over the last 10 years, actually 20 years, in the rate of all forms of tobacco use. But interestingly, there's been a strong reduction in cigarette use and a very strong increase in e-cigarette use. We all know, but it needs to be reinforced at every time we talk, that tobacco use in any form is unsafe. I could detail all the different relationships between tobacco and cancer. I think we know that pretty well. It's still here, it's still strong, and it's not gone yet. We hope so. And then the question, one of the questions is, do e-cigarettes cause less damage to a person than combustible cigarettes? And the honest answer to that is that we don't exactly know. There's some strong speculation that because there's fewer chemicals in e-cigarettes than toxins in cigarettes by quite a bit, that theoretically and probably they're safer, but they're not harmless. And what I want to talk about is where the harms are with e-cigarettes. Clearly both of them have some damaging aspects to it. So I think in the debate that's going on across the country about e-cigarettes versus regular cigarettes, we have to keep a few points in mind. One of them in particular is that I think youth are frequently being left out of the debate. So if my uncle or my mom or dad or kids smoke cigarettes, I might be tempted to talk to them about the use of alternative nicotine replacement therapies, and possibly even e-cigarettes, even though that e-cigarettes to date have not been unequivocally been proven to be effective as a smoking reduction tool. Turns out a lot of studies show that people who smoke that use e-cigarettes end up using both of them versus just completely switching to e-cigarettes. And one hopes then that the e-cigarettes are there as a temporary tool to get over the addiction so they can quit altogether. That still remains to be seen. But in terms of kids, what I have seen, and I've looked at a lot of literature, is that youth and young adults are vulnerable to detrimental consequences of brain exposure to nicotine. This becomes a pretty tricky thing to do when you're reading the literature in terms of separating whether it's nicotine or all the other constituents and toxins and chemicals in tobacco smoke. Is it the nicotine or all those other things that cause the harm? And one thing we know for sure is that nicotine is addictive, and that nicotine will cross the blood-brain barrier in equivalent or even higher doses than regular cigarettes. So even though we don't have strong evidence yet that e-cigarettes are addictive because of nicotine, in fact, I will be publishing a paper soon on this, which shows that that could be true. But anyway, we know that nicotine is addictive in the human system, and we know that there's also good evidence that nicotine acts as a priming substance for other addictive behaviors. It's what people call the gateway theory. Hypothesis, that if you're exposed to nicotine, it changes the way your brain receptors interact, and it makes it more likely that the first time you try another substance like marijuana or alcohol or cocaine, that you have a different kind of reinforcement than if you had tried it without ever using nicotine. So there's evidence to that effect. And in addition, We've seen that nicotine can have an action on impulse control. It can also have an action on deficits in attention and cognition, and nicotine is related to mood disorders like depression. So you have to ask yourself, if you're a classroom teacher, do you want kids that have less of those things, less attention and cognition, have less control over their own impulses, and more depressed? Clearly the answer is no. So there's some problems. We have to sort out a lot of it, but there's still problems. Nicotine, when we think about teen pregnancies and how many teenagers actually plan to get pregnant in America, nicotine crosses the placenta and it has known effects on fetal and postnatal development. Nicotine delivered by e-cigarettes during pregnancy can result in multiple adverse consequences, and these include preterm delivery, that's a problem. Stillbirth or sudden infant death syndrome is strongly related to nicotine use. Altered corpus callosum, deficits in auditory processing, which means slower learning if you're unable to hear properly, and interestingly, childhood obesity. So all these things are associated with nicotine exposure. We still have a lot of research to do to say that they're causal to nicotine. But we do know from animal research that you can stimulate these problems by giving animals just nicotine. So whether it transfers to human, we have to do more studies, and we'll end up figuring that out. Thirdly, an unanswered question in regards to the addictive potential of youthful users who smoke only e-cigarettes. And like I said before, that you do get nicotine in the blood, especially with the third generation devices. We're in generation 3, almost 4. They've been improved. They deliver it better. So clearly, there's lots of concerns about kids, and I'm afraid that this epidemic of the use of e-cigarettes is going to cause another generation to become addicted to nicotine, and they will eventually go on to become regular cigarette smokers. That's a big problem, even beyond just the things that are bad with nicotine all of itself. So in addition to those problems, you may have heard that the lithium batteries can explode. So this sounds a little morbid, but I've collected a whole bunch of pictures of people. This guy actually looks like a Dr. Strange. He's from Canada, but he clearly wasn't expecting that to happen when it exploded in his face. This is a couple posters from a San Francisco media campaign. Some call us harmless water vapor. It's neither water nor harmless nor vapor. There's a lot of misconceptions out there, and that's what the curriculum is designed to change. So let me just jump right into it. So the Catch My Breath program, we started it in September of last year in 2015, went through a development process. It's based on a program that's out there, has been used for a long time, and is a strongly evidence-based, the Minnesota Smoking Prevention Program, which the theoretical foundation is social cognitive theory if you're a health education person. We also did an updated literature review as to what are the predictors, what are risk factors for the onset of tobacco and the onset of e-cigarettes. And these are the traditional type of areas that you'd think about. And then we did interviews with teens. So we talked to them, found out that they're very curious about e-cigarettes. They don't know what they are. There's a lot of misinformation. There's a lot of social media information that's just flat out false. So our children are being exposed to wrong information. Then we did interviews with teachers about what might be the right format, what would they like to see in a curriculum. We got feedback from teachers. We created a first draft. We showed it to 20 or so teachers. They gave us extensive comments, and we revised it. Then out of all of that, we set these goals. The goal, of course, is to prevent the onset of e-cigarette use amongst preteens and teens. The intended outcomes are to resist their curiosity, understand that they're addictive, and that their peers and friends aren't really using e-cigarettes that much. We want to reduce the social desirability to use it in the first place. That's a key element. So we designed a curriculum. It has 6 lessons, approximately 30 minutes. The content is delivered by teachers, nurses, tobacco control experts, etc. A variety of educational strategies are used, the ones that you often see with middle school kids: cooperative learning, group discussions. We tried our very best to make it user-friendly and flexible, and to align it to national standards, and so far we've aligned it with Texas standards too. Here's just a picture of, we put the program online. This was some feedback we got from teachers. You have to make it digital. You have to make it easy. So a teacher will log into the system. They'll be able to see the outline, the activities, the materials. I wrote a little bit longer overview in each one of the sessions because these are new, and frankly, not a lot of people know details about e-cigarettes yet. So this is intended to train the teachers a little bit so they feel more comfortable about covering this type of information. It's all right there. Teachers can call it up. There's a set of PowerPoint slides in the yellow. You can see that. And just call up the slides and go and start teaching. Each of the PowerPoint slides in the notes page has all this information in case teachers want to review it right before. We designed it so you can walk in the room, click on the slides, and start teaching as friendly as we possibly can. We did a feasibility study from March to May in 26 schools, and we'll hear from Lisa Cummings in a few minutes about her experience with it. Taught it. 15 schools were able to do a pre and post survey. We did it in 5 different states, and we reached over 2,000 kids from 6th to 8th grade. Some of the feedback we got from our evaluation, which I will say was not a full-blown evaluation, but still a good one with lots of kids. Most of the teachers agreed that it was culturally appropriate. They felt confident to teach the curriculum. We trained the teachers with a 1 and 1.5 hour webinar training just like this. So teachers were able to learn what they needed to learn, jump right onto the website and start teaching it, and felt good about that. 86% agree that they liked all the resources. I tend to give too much. That's part of the professor in me. So if you're interested in this topic, you can go pretty deep. If you're not, I won't say not interested, but if you don't have the time to dig deep, you can just jump right in and start teaching it. So what do the kids think? Almost 90% said they are less likely to use e-cigarettes because of participating in the program. And that was sort of the holy grail here, what we wanted. 82% agree that they'll look at advertising differently. They increase what they know. They discuss what they learned with their families and friends. We have a Pinterest page for parents to go and visit to learn about e-cigarettes and tobacco. We have part of the curriculum are assignments where they go home and interview their parents or some other adult in their life. So I'm pleased that they're actually learning. And basically what I want is the kids to talk to the parents and, what do you think about tobacco? And what do you think about e-cigarettes? Do you think I should use them? And almost all parents, all tobacco smokers, all the ones I know at least, and surveys support this, they always say, no, I wish I had never gotten addicted to tobacco. And it's really hard to give up. So all these numbers said the program is feasible. Teachers like it, kids like it, and we saw no unintended negative consequences. So it says to me that's a go. We did learn a lot from this, and we made revisions. So our future directions are we redesigned the program over the summer, tweaked it a bit based on the feedback. We're going to continue to tweak it. Right now, we're in the middle of developing what we call a learning community in Central Texas, thanks to the St. David's Foundation, a local group here in Austin, Texas, that gave us funding to implement this program in 150 schools in Central Texas. That's across 5 different counties. And what we want to do is get the program out there, get it in use, and continue to learn from the program to make adjustments. The program is available. Since the end of the pilot test, 20 more schools, including 2 more states, have implemented the program. So we're getting regional, we're getting national feedback from places. In at least 2 states so far, and 1 county health department is planning to offer Catch My Breath free of charge. And by the way, we're charging $25 a school, but we're finding philanthropy or state agencies taking that cost over, so it's free to schools. 2 states want to do the whole thing in all their middle schools. Very excited about that, and it illustrates the need that's out there that schools are faced with when kids are asking them questions about e-cigarettes and they don't know the answers. We're going to do more curriculum revisions. We're making more school posters. We're in the process of designing sort of educationally related PE lessons, which are more game-oriented, where there's some e-cigarette education built in. We do this commonly with our Catch PE. And I'm in the middle of writing an NIH randomized trial, which I'll submit in February. And as always, I'm hopeful that I'll get those NIH grants. They're hard to get, they're hard to write. But if I do, in a couple years, I'll have very precise evidence of how this program is operating and whether it works the way I think it does. So I'm going to toss the baton to Lisa.
Great. Thanks, Steve. And once again, if you've got any questions for Dr. Kelder, please type them into the screen. And welcome, Lisa.
Thank you. Thank you for letting me share a little bit about how we brought the Catch My Breath program here to DeKalb County. Again, I'm a registered nurse in the Community Wellness Department here at the health system, and so we have very good relationships with our county schools, bringing in other types of health promotion programs, and so we knew that this would be received very well, and so we decided to take on a couple pilot schools with the program. For those of you that are familiar with health systems, they have to do what's called a community needs assessment every 3 years, and that's part of the community benefit for health systems. And so the last go around of our community needs assessment, we were concerned because we were seeing very high incidence in cancer, specifically in lung cancer, and it was found to be the leading cancer site for both men and women in the county. And so once that community needs assessment is completed, then you form your strategic plan in addressing those issues. And so the Catch My Breath program came at a perfect time for us because our strategy was to look at programs and support activities related to smoking prevention programs in school-aged children. We do have some tobacco prevention programs more towards elementary schools, but nothing in the middle school, and specifically nothing when it came to e-cigarettes. Next slide. Oh, thank you. Next slide. Sorry, I'm going off my own notes here. Okay. All right. So knowing that we were going to bring this program to our schools, we had to decide which schools we wanted to pilot the program. And so we chose 2 of our middle schools that we have a very good relationship with Catch in the classroom and then also after school. So we brought that program there and talked with the teachers and worked with them. They did not want to teach the program. They wanted 2 of us nurses to come in and to bring the program, which is what we do. And so we were happy to do that. But we had to decide when we were going to teach those 6 lessons. And for those of you that work with the schools, you know that time is of the essence, and it's very difficult to get in there with all the things that they have to get done and testing, and so we found ourselves in a little bit of a time crunch. Both schools decided that they wanted to implement it during their health class, and in those schools they have 6-week rotations where the students have health and then they rotate out. So again, they were wanting to give us 3 days, which of 45 minutes, to be able to bring these 6 lessons into the pilot program. Next slide. Okay. So our challenge was to combine these 6 lessons into those 3 days that we were given. The way the program's laid out, it really is shown to 6 days of teaching it and then some poster presentations, but that wasn't going to be the case for us. So we had to take that challenge and make sure that we fit all those 6 lessons into those 3 days. And so we had a little bit more planning probably than somebody that was going to do the 6 days of teaching. Also with planning and preparation, really working with and preparing the peer leaders. That's a centerpiece of the program, and so putting that extra time in there, whether it was with the folders or training the peers and communicating with the teacher what that was supposed to look like, made all the difference in the world in terms of the program running smoothly. Next slide. Okay. So again, after implementing the program, again, peer leaders were the ones that really took that lead and directed the small group interactions. And what worked for us was ahead of time we made peer folders that we had the activities separated in there by each lesson, so it was organized. As you know, middle schoolers are not that very organized, so we tried to make it as easy as possible. And at the end of the classes, we collected those folders so that we could have them ready for the next day of class. We also found that the combination of all the different activities, such as video, interactive exercises, really kept the kids engaged and that they participated. And you can see in that picture right there, this is a great activity called Parallel Lines, which they are practicing refusal skills. And so it gets very loud and very rowdy, but they walk away with a little bit more confidence being able to say no. Next slide. So the student response. When we first started, it was interesting that almost all the kids had the perception that e-cigarettes were a healthy way to smoke and that they were positive because they would help people quit smoking. And they knew many family members that smoked e-cigarettes, or even friends that had told them that it was safe. And so seeing that change of the perception of the safety with e-cigarettes before and after the program was really great to see as they kind of evolved, as they received that data and that information, and we had conversations. And that eventually changed by the end of the program to them being very concerned about people thinking that this was safe and a potentially healthy, way to smoke, and seeing that they completely turned around and knew that that was not the case. The end of the program project was very impactful. We did poster presentations, and the students really put a lot of work into that. And in fact, they wanted to share it with the rest of the school. And so throughout the middle school, they chose strategic places to hang those posters. And again, I think what made that so great was just seeing how that perception changed, over the curriculum, and, how they were feeling about that now. Next slide. So, oops, I was going to say lessons learned. Oops, can you go to the next slide? No? Okay, we'll go back. Go ahead. All right, so future implementation. We plan to continue to bring the Catch My Breath program to the 2 middle schools that we currently are in, and we hope to bring that program to other districts as well. And so we hope to be a part of the school wellness committee meetings and sharing the program with them. The health system supports this program, again, because it's part of our strategic plan, and we are showing that we're trying to make a difference in our community with those rates of lung cancer. Also, future implementation, we really would like to look at other ways to bring Catch My Breath to the schools. We had a very unique situation in that we had 3 days to incorporate the program. But we'd like to look at other ways, possibly in PE or an after-school setting. And so for the next year, we're really going to look at some opportunities to try to do that. Next slide. All right, and with that, I want to thank you. If you have any questions, definitely let me know. And want to thank Catch Global and the University of Texas for creating this curriculum for our kiddos.
And we'd like to thank you too, Lisa. Thank you so much for participating again, and thank you for all you're doing in Illinois and DeKalb County in particular to help teach our kids to be healthy for a lifetime.
And you hear Peter's accent. He forgot to say, "Go Cubs."
I was actually there for the parade. The most amazing experience I've ever seen.
Can you believe that?
I was one of the 5 million. Yes. Very good. Well, we've had a couple of questions, and Steve, maybe this one could be directed to you in the first place. Is the cost of the program per session or year? If they wanted to do it again the next year, would they have to pay another $25 or?
Yeah, we're requesting $25 per school per year. And what those $25 cover is the online system and updates. We plan on continuously updating those materials based on user feedback, and that's the price point where we felt that it was feasible to be able to do that. And remember, we're a not-for-profit foundation, It's the cost of hosting the website as well as our own professional input and updating it. But good question. Thank you.
Yeah, I got one more too, Steve. So would this be a good program for a cohort of students who have been caught, basically violating the tobacco-free school policy for e-cigarettes?
I think it would be. I designed it as a prevention program, so not so much for kids who are already hooked on nicotine. That's clearly one of the next steps. I've been getting that question. What do we do with kids that we identify as already current users? I'd probably need to modify it some, but I think it would be a good program because it covers all the key risk factors and is intended to get inside the heads of kids so that they're better able to make more informed decisions and to recognize that it's not something necessarily that their peers are excited about. So there's a number of avenues to do it. I think in substance abuse classes, I'm thinking, one of the areas of students who tend towards tobacco are those involved in not so much the sporting crowd, but the now I'm blanking on it. The entertainment kids, the kids who are involved in Glee Club and in music and such. Fine arts. The fine arts tend to smoke at a higher rate, so it could be taught in those classes too. A couple other future things that I've gotten questions about. What do we do for fifth graders? And I indexed it for sixth grade because most kids aren't using at that age, but then between sixth and seventh grade, it goes up. Between seventh and eighth grade, it goes up even higher. Between eighth and ninth grade is when we're seeing, those 7 to 8, 9 years is when we're seeing the peak increase in use. So I targeted sixth grade to begin to work that prevention. There might be certain areas of the country where fifth grade might be appropriate to do that too. So that's on the drawing table right now, is to augment with some fifth grade lessons. In addition, the same way, ninth grade as well. So I'm getting questions about that, and I hope to be able to accomplish those tasks sometime over holiday break.
Great. Thanks,
Winter
Steve.
holiday.
Yeah, thanks, Steve. A question for you, Barry. You cited the violation rates of e-cigarette sales to minors at 6 to 7%. Is that right? What does that mean? 6 to 7% of what?
Okay. What that actually means is for enforcement of under our state law, they'll go and do a control buy or a sting, if you will, where the law enforcement agency, law officers will actually go in with a minor who will make an attempt to purchase. And so that's the number of times, the percentage of times they were actually successful at making a purchase of either a cigarette or smokeless product or an e-cigarette type product.
Very good. Thank you, Barry. Maybe this is another question for you, Steve, from a training perspective, and this comes from Kevin. Do people need to be trained in the CATCH curriculum before they can use this information, or is this going to be available to use for anyone working in this area?
Yeah, well, I wrote it for both scenarios. So, the training that we put together for the webinar format is an hour and a half. So I wanted to make that as, first of all, get people comfortable with the information and able to teach it, but second, I'll not take too long. And it seems as if that worked real good with the 26 schools that we trained in the spring of last year. But I also spent a great deal of care adding information so that, an experienced teacher or youth educator or, someone that's used to, well, first of all, dealing with middle school kids, not everyone can do that. I think we all know that. But if you got those fundamentals down, you should be able to read through the program materials that are online, or if you print out the whole booklet and jump right in.
Right. And just one more, Steve, too. Stephanie usually works with fourth graders. Would it still work with fourth graders?
I try to be careful when I start thinking about stretching up or down the age range. I would have to think a little harder about fourth graders and match their developmental capabilities. In certain situations, kids aren't great at writing or reading even by fourth grade, so it might not work. If your kids are on pace and on task for age grade level reading, writing, and such, it might be appropriate, but we didn't test it there, so I don't know for sure. I think that would be up to the individual teacher to sort of make that decision. But that's a good question. As I think about moving it down a grade to 5th grade. I can think about moving it down to 4th grade too. Typically I'll index a program for a certain age, and then you start thinking, well, what's more appropriate for 8th graders versus 6th graders? And so I've tried to cover that spectrum pretty well with these 6 lessons. But yeah.
Great. And maybe this one for Lisa and Steve. Stephanie asks here too, I'm trying to figure out what items I need to purchase to support this program.
Well, it's intended to be sort of self-contained. You know, the posters at the end, I assume schools have some kind of posters, or the kids sometimes will get them through their parents. So posters and markers are really the only supplies that you need to do this. The school, well, I should say we're busy working on school posters, so there might be some expense if you want to support the program with signage in the schools. We haven't done that yet. I met yesterday with a team of creative people in the advertising school to do just that. So I don't know how much they'll cost, but we intend to put them online in PDF files so schools can just print them off. So that's an internal expense, I guess, doing that. And if you want to print out the handouts, there's some handouts that are needed by the peer leaders, because we use peer leadership to implement this program. So what I'd like to do is to figure out best how to put those online so that kids that have tablets or computers in the classroom can just use that instead of it. So it's sort of minimal, I'd say, but typical of teaching.
Okay. And Lisa?
Yeah, I agree with Steve, definitely. As far as the creative tools that we needed for posters, some of the schools already had that, and we're part of community wellness, we have a lot of stuff that we could pull from our department, and so the health system really supports that. I will say also that one of our teachers did say about, you know, how do we get these forms electronically on the kids' computers. They have those little Chromebooks, and so he was really trying to lessen the amount of paper and printing and seeing how he could possibly do that. So I wasn't sure if that's down the road.
Yeah, that's our goal. There's a number of different configurations by a number of different school things where they use Google or iPads or things like that. So we're currently investigating how to make that more user friendly, and I hope that we'll figure that out reasonably soon.
Great. And this may be one back to you, Lisa, to answer first, and then Steve to follow. How do you choose the peer leaders? Is there training for them outside of this class?
Well, according to the curriculum, there is a peer leadership training, and again, depending on how much time you get with those students, because we didn't have the time in the classroom because we needed that to teach. So we had to work with the teacher and talk about what we were looking for in peer leaders, and he was the one that did choose them. And so by the first day, we already knew who those peer leaders were. They were expecting to be told that they would be the peer leader. And so I honestly think if we could have had a little bit more time with them to, you know, kind of pump them up and, you know, get them ready, I think that might have been a little helpful.
Yeah, I mean, what we decided to do when we wrote this, or when I wrote this into it, is there's a long literature on peer leadership as enhancing the effects of substance use or social type behavioral-oriented programs, and part of the reason for the peer leadership is so that the kids themselves can sort of turn the information into their own local language. So it's a way to get around cultural barriers or incorporate the variety of different cultures in speaking styles and local vernacular and such, is to let the peers do it. And frankly, kids are better at receiving social information, like, you know, whether or not you should go to a dance or not, whether you should kiss a boy, or whether you should, you know, whether you should smoke or drink or start doing things as they feel more adult-like. They're asking their friends for information. So we want to supply the peer leaders with the ability to be able to talk about a variety of topics. So one of the ways to do that, and it's not, there's more than one, of course, but here the one I chose was that the teachers have a little election in the class, and they just have the kids write down the names of the kids in the class that they would most like to be like, and that they look up to. So sometimes that's the academic nerd kid, sometimes it's the football star, sometimes it's the whomever in the class, the most popular kid. It doesn't matter to me so much in terms of if they're even a kid who's a little bit deviant, or I mean not like way deviant that they're out of control, but deviant in that they might have actually tried a cigarette or have been precocious with other things, because what we want is leaders in the class. So this program, when I say peer leadership, isn't as heavy duty as some of the bullying and other types of peer leadership programs where they really need a day's worth of training. In this case, they're running small group activities. They're given a booklet, and they ask a question to the group, and then they record what the responses are. And then the teacher brings back those small groups and says, so what does your small group say? So group A, what did you guys say? And group B. So it's sort of a light load in peer leadership sense. And I guess one could not do the training, because there is a recommended training to work through of about, an hour, hour and a half that the teachers would do with the kids. But I recognize that time is of essence. So you did it pretty well without doing that, Lisa. But I think the program will work a little bit better if one has the time to do it.
Thanks, Steve. Yeah, I just heard from Duncan that the teachers can download the resources from Digital Catch, digitalcatch.org, or go to Catch Info and click on to Digital Catch, and then email them to students. And so that's a free resource at Digital Catch. One more question, I think, Steve, maybe Barry, if you want to weigh in on this one too. When conducting the evaluation, do you feel posters hung by students in the school between class groups, by early classes, may have affected the knowledge of students surveyed in later groups?
Well, that's always possible. I mean, the intention of the posters is to supply new information. You hope that you put them in places where kids are going to see it. So, from an evaluation perspective, you want to know what kids know on the front end, and then measure them on the back end. So a pre-test versus a post-test. So if you're rolling out a program that goes outside of the classroom, like putting posters up or doing activities in the PE, one needs to take care when you're doing the evaluation of that way. So I think most evaluation teams would take that into account. But if you're in the field and you want to implement the program, I don't think that's going to be too big of a problem. I mean, the overall goal is to keep kids from starting to smoke e-cigarettes. And if your school is registering 20, 30, 40%, then you clearly have a problem and you need to work on it.
Right. Barry, just wondering, I know specifically in Texas you got this information, but from what you've found, what's probably the most effective strategy around tobacco awareness or youth education?
Really, for us, we've looked at is the peer side of it, and not to really be the adult trying to say I told you so, or trying to preach at them, but really let the kids understand what the industry is doing to them, or let the kids understand how they're being influenced by the industry, and really kind of empower them to take the ownership of that information and take ownership of them telling each other. And from that standpoint of it, really, so the traditional, we tell you it's bad, so don't do it. Yeah, that's great for smaller kids, but when you start talking to teenagers, and particularly older teenagers, they really want to need to make that decision themselves, and by giving them the right information and empowering and trust them to make good decisions, we've been seeing that works really well.
Great. Yeah, thanks, Barry. Last question for Lisa. What would you say your biggest learning was for your team and the students as a result of this pilot?
Well, I will say that we did not know all the information that was out there about e-cigarettes, and so the nurses and I, we really learned a lot, and we realized how important this program is for our kids, because the misconception is so backwards, and that this is a good way to stop smoking, and that it's cleaner and healthier. And so we really took that away as this program is important, and we need to make sure we keep this in our curriculum and that we keep bringing this to our area middle schools.
Great. Thank you, Lisa. And we're just about run out of time, so I wanted to thank our three experts today, Barry, Dr. Kelder, and Lisa Cummings. Thanks so much for your time. Thanks for everything you're doing to help educate not only the kids, but the parents and the communities about e-cigarettes. Remember, there's a recording of today's webinar will be available online at catchinfo.org, and also a PDF of the presentation slides. If you have any questions, queries, concerns, please feel free to email Megan Graylis at the email address you've got on your screen. Once again, till our next webinar, bye for now.
Thank you, Peter.
Thank you.